Well, I was just going to start by saying that when you told me that you were going to get involved in politics, I thought you were really brave.
Yeah.
You know, dealing with issues that affect us all on the Isle of Man, but they're seemingly impossible to solve. But then when I heard what you were saying about each of those issues, that made sense to me in a way that I hadn't heard before. And I think the point of this interview would be to make sure that the people who you would potentially stand for hear what you told me in simple terms. So we are here in Leonardo's, which is one of my favourite places on the Isle of Man. But there is significance for you being here in that it is within your constituency of Arbory,
Castletown, Malew. Yeah.
But before we go into kind of local politics about the area, I thought we should probably touch on your leading talking points, because I know that there are some that you think very strongly about, and one of those is our National Health Service.
Yeah.
What do you think of the issues? Because we all know there are some.
There was a review done by the West Midland Review back in 2014, and what that highlighted was certain issues within the hospital. So the review, which is online, people can see, and I think it's important for people to understand the issues in the hospital, because I think it's important for public confidence that actually we start to rectify what this review highlighted. So in England, what they have is the Care Quality Commission, which is set up predominantly to ensure standards within the hospital and departments. And so if I use an example with a hospital in the UK called the Basildon Hospital, they had similar issues to Noble's Hospital. So they had issues with management, they had issues with standard of care, they had issues with public confidence. And so they put in place a chief executive with a proven track record to turning around failing hospitals. So Claire Panika, I think her name was, so she came in, she implemented a whole new management structure within the hospital. She modernised, she put in a new system of governance, she put accountability and transparency at the heart of what they did. And she worked alongside the Care Quality Commission and the Trust Development Authority. And the main point is that in 2 years, Basildon Hospital was transformed from marked as delivering poor quality of service to 2 years later, they were given good quality. So they were given a good bill of health. And I think the main points for our hospital is, number one is that we have to address the issues in the West Midland Review. Number two is placing our hospital under independent regulation with the Care Quality Commission and the Trust Development Authority, because they can hold managers to account. That will give a direct line of accountability, leadership and authority. So it takes politics out of this vicious cycle. So thirdly, I think for the hospital as well is that we need to track down and headhunt a chief executive who has the background, who has the credibility, who has transformed failing hospitals in the UK. And if that means paying 50% more than what the UK pay, it's worth it, even 100% more. We have to bring in someone who can transform the management system in the hospital. Again, if we talk about the budget the government needs to make, is that there has to be a priority budget so that what the hospital needs, the hospital gets. Then we need to make provision for investment in the hospital, so that's more staff. The chief executive of Basildon said that what her priority was to ensure that there was communication amongst staff, that there was accountability and transparency. And she made that point that all staff met together, they discussed things, they talked with patients, and she just made it more open, more transparent, and that started to boost staff morale in and of itself, with the Care Quality Commission, implementing strategies to take it from there to there, and that is exactly what Noble's Hospital needs.
Well, it's an exciting prospect, because I think it's so necessary. So I understand why that was your top talking point. What comes under that issue too is mental health services on the Isle of Man, because I know that you feel strongly about that.
I think again with mental health services on the island is that what we need is independent regulation, and we need an independent full-scale review on our mental health services to see where we are compared to, say, the UK, compared to where we are and where we should be standard-wise. I think as well with mental health, we have to, again, it goes back to a priority budget. I think mental health needs investment. If I contrast the West Midland Review, in terms of what they expose to the hospital. I think we need, again, a review on our mental health scenario so that we can form a long-term strategy and give direct investment where it's needed. You know.
That's very good.
Yeah.
That sounds great. And I think another solution on escalating costs of the health service, I know that one of the, I think this is a talking point that on first reflection sounds like it should be probably one of the most controversial ones, but actually it's got considerable merit. And what I'm talking about is the legalisation of medical
cannabis.
Yeah. So your thoughts on this, because I know that you've done a lot of background research.
Yeah. One of the things I said to a minister when I was lobbying for the legalisation of medical cannabis was that I said, well, okay, so why wouldn't you support cancer patients being able to try medicinal cannabis oil, when all other treatments have failed? Like my dad had chemotherapy, twice. That gave him a small heart attack. He couldn't have any more chemotherapy. So why couldn't he, have cannabis oil? Why couldn't he try cannabis oil? There's not enough evidence. So I said to this minister, I said, okay, well, why don't you go and sit in the hospice, sit in with a patient who is dying of cancer, who is terminal, who may only have days and weeks left, and you tell that person and the family and say, look, you cannot have medical cannabis because there is not enough evidence. I know you're dying, but you can't try it because, there's not enough evidence. But, do have as much heroin in the form of morphine and diamorphine as you see fit, because that is the madness of the situation we have. If we legalise medical cannabis, what that would do is, first of all, there's the moral issue that people suffering with MS, epilepsy, and so on, should they not have the right to this medicine? But we can look at replacing highly expensive drugs with medical cannabis, and actually, I think it comes down to an individual choice. If someone is suffering with MS, epilepsy, the pharmaceutical drugs that they are taking doesn't agree with them, then why should they not have the option to say, can I please try medical cannabis, because if everything else has failed? So long term, I think the benefits of medical cannabis could have a profound effect on our government revenue. And another thing that I would say is that I think we should be trialling medical cannabis for treatment of cancer. So I know on one hand you have people who are sceptical, who say, well, I don't think there's enough evidence, no, we need to stick with chemotherapy and radiotherapy. But I would say, look, if you have 100 volunteers, because my dad would have been offered a different treatment in Clatterbridge, they do that all the time. They say, look, okay, this form of chemotherapy isn't working. Do you want to trial this drug that we are experimenting with? So it's under those conditions. If you're talking £30,000 for chemotherapy for one treatment, potentially it could be a couple of £100 for cannabis. And if we find over the long term that actually cannabis is having the same effect as chemotherapy, if not better, then is it not economical and logical to change treatment?
It's a no-lose situation.
Yeah, absolutely.